Welcome to NP 702 Primary Care 1. This is your first primary care course out of the 3 primary care courses you will take at FNU. And my name is Dr. Stone-Gale. I am the course coordinator for the course, and also with me is Dr. Heather Wilkinson, and she will be in the course for 10 hours a week, part-time. To give you a little background on myself, I'm a family nurse practitioner. I received my diploma in nursing in 1984 from Massillon Community Hospital School of Nursing, and that was in Massillon, Ohio, one of the last diploma classes at that hospital that closed back then. I then went on to do my bachelor's and my master's degree at Barry University in Miami, Florida, where I got my family nurse practitioner. And that was approximately 25 years ago. And I then went on to do my DNP, and I did my Doctor of Nursing practice at University of Alabama, Birmingham. I've been with FNU for approximately 3 years teaching. I've been teaching this course for over a year and a half. And prior to that, I was teaching at a university in Fort Lauderdale, Florida, where I live currently with my husband. I have 3 children, grown children with grandchildren. And they kind of live all over. One of them is in Orlando, one of them is in Boca Raton, Florida, and the other one lives right here by me in Davie, Florida. And I have a wonderful husband who's very supportive of everything and loves me being a nurse practitioner. Dr. Wilkinson is an FNU DNP grad, and you can read about her bio under the People section where she has that listed. So let's talk a little bit about what we're going to do in the course. First of all, the first thing we're going to do is have a BBB Orientation Q&A session, and that will be held on Tuesday night after the course opens on January 3rd, and it will be at 8 o'clock p.m. in the BBB, and I will send out an announcement about a half hour before if you cannot attend and you do need to call in for that. I will also send out a notice for the time and everything for all of you to go into the conference center in the course to be able to go in. And at that time, what we're going to do is we're going to review the syllabus, the course schedule, the general course instructions, as well as all of the modules, the exams, and the assignments for the course, our grading, communication, honor code, and social media policy, and go over Proctorio. So in this course, we have quite a bit of content. It's very content loaded. There's a lot of information, and there are 5 modules. In Module 1, it will really be your heaviest module because we're looking in that module at family health, at the family health model that goes with primary care. We're looking at breaking bad news to patients, which is something as a nurse practitioner in practice that you're going to need to do with your patients, hopefully not on a frequent basis, but this is going to occur throughout your career, definitely. We're also going to look at eye disorders as well as ears, nose, sinus, pharynx, mouth, neck, and that is kind of like from the neck up is what we're going to be looking at in Module 1. So it's a heavy module. Each module goes over 2 weeks, so you have a bit of time to study the content. And the family health model and the breaking bad news section lesson are very, very minimal. So the main content is focused on the other stuff. For Module 2, we're going to look at male GU disorders as well as renal and bladder disorders. That content will cover over 2 weeks. Same with Module 3, 4, 5. It will be over 2 weeks. So we'll be looking at upper body and lower body musculoskeletal disorders, chronic and arthritic musculoskeletal disorders, anemia. We touch a little bit on chronic lymphocytic leukemia. We could touch a little bit on HIV. And then Module 5 will be dermatology for the full 2 weeks, and that's dermatology 1 and 2. So how are you going to get started in the course? Well, for week 1, the things that you're going to need to do are to read the syllabus thoroughly, make sure you understand the requirements in the syllabus. In the syllabus, also, you are going to see the topical outline for the course, and it's going to tell you exactly what content that you will be responsible for. If it is not on that sheet for the topical outline, you are not responsible to read it, although you may do so to improve and enhance your knowledge. But there's only so many things you can cover in this course in 11 weeks. So we've kind of pulled out the most common things you'll see in primary care and the most important things that you need to focus on. Then you go, and the syllabus also will cover the grading section, what to expect as far as percentages and so forth. Then go on to read the course information section. The course information section is in the, when you click on modules, it says start. So you'll read that. It goes into the course schedule and the timeline for the course schedule. So when your exams are going to be due, when your assignments are due, and so forth. And then general information about the course. And this will cover content in regards to what you can and cannot do in the course, what your responsibilities are in the course, what the quizzes will be like, what the assignments will be like, and so forth. And then there's also, in the module, there's a section on reading communication, the honor code, and social media policy. Those are listed for you to review again. And then Proctorio. And there's also a student demographic section, which I like you to put your name in and the hours that you work and your contact information. And this really does help Dr. Wilkinson and I look at if we need to contact you for something when you're available, and when, not to interrupt you during your work hours. And this also is good if you develop a study group for your partners to look at and see when they may be able to contact you. So the first thing you're going to do then is start in Module 1, and that will cover the first 2 weeks of the course. And then you'll go to Module 2 and all the way through to 5. But start with Module 1. Every other week, you're going to start a new module. And when you start that new module, you need to look at what the objectives of that content for that module are. Look at the actual content for the course. What are we going to be covering in that course? There's module readings for every module, every section that you need to read. There's also PowerPoint. So there's a full PowerPoint which is usually about an hour long, that you can print out and you can write on while you're watching the mini lectures. So the PowerPoint topics are broken into mini lectures. Some of them are not on mini lectures, but the majority of the content is. But this way you can take your big PowerPoint and you can make notes on it and use that as a study guide. I also have YouTube videos in the course, which are excellent, and they're reflective of the content. And some of them are just so well done that we felt that we needed to add them in the course to help you. There's also the mini lectures, which I talked about. And then the exam information is at the bottom. The exam information will tell you what is covered on the exam. All the exams are closed book. And so just read through that. And then, as I said before, you're only responsible to read the content that is listed in the topical outline and see that syllabus for specifics on that. As far as the graded content in the course, there will be 4 open book quizzes. These quizzes will be remotely proctored, but you will be able to use your books and you will be able to use the internet, although you will need to open tabs that you're going to use for the exam prior to the exam opening, because then you will not be able to open them after. There is a midterm exam, which is in week 6, and it also is remotely proctored. It is a closed book exam. You must achieve an 80% average on all of your exams in order to pass the course. And that means that you will take your average of the 4 quizzes and the midterm and divide them into the total points that are for all the quizzes and midterm combined, and that will give you your average. So you need to have an 80%. There's also 3 assignments due in this course. One is a written prescription assignment, which is due in week 3. And that assignment is a very brief assignment. It's worth 4 points. And it really is an assignment where you are going to write a prescription for a medication and then another prescription for either a lab test or a diagnostic test. And we'll discuss that more when we do the orientation BBB. This soap note video presentation also is due at the end of week 4. You will have a partner for this, and we will go into this in depth during the orientation. But this one, you'll do an episodic soap note, and you'll do a video presentation with slides to present it. And then, of course, your ending reflection, which you can turn in at the end of week 9. And that is basically what you do in most of your courses, is do an ending reflection on the course. So let's look now at the grade breakdown. On the 4 quizzes, they will be worth 10 points each, and they will be worth, 40 total points, or 40% of your grade. And then the midterm exam is also worth 40 points, which is 40% of your grade. So as you can see, the midterm and your 4 quizzes will equal 80%, and that's what you need to pass. The other 3 assignments, the written prescription is worth 4 points, or 4%. Your soap note video presentation is 15 points, or 15%, and the ending reflection is worth 1 point, or 1%, to equal a total of 100%, or 100 points. So it does not matter if you get 100 on your written prescription, your soap note, or your ending reflection. If you do not pass those quizzes in midterm, you do not pass the exam. So those are very important that you focus on them and get an 80% or above. For the exams, there's no whiteboards allowed, no paper and pencil, no phones, no food, no one in the room with you. That includes your pets, your kids. Nobody can be talking to themselves, trying to answer questions to themselves, because we don't know if you're talking to someone else or you're truly talking to yourself. There will be no makeup exams in this course. If you have an emergency, then you need to contact myself or Dr. Wilkinson, but emergencies are emergencies. Emergencies are not where I'm not able to study for my exam because my work schedule's busy, or my computer broke, or my hand hurts. Your exams cannot be made up for those reasons. We will look at each person on an individual basis and determine if you can get an extension, but usually those extensions for the exams are only in an emergent situation. If you're in the hospital, your husband's in the hospital, your children are in the hospital, you've had a death in the family, these are emergency situations, and there will be no exceptions to the makeups. At the end of every exam, there is a 5-minute review that you will get, and that is sufficient enough for you to look at the questions that you think you may have missed and see what you look at the rationale for the questions. If you want to make an appointment to discuss a question with a faculty member, you may do that after the exam closes. Faculty will not respond to your emails and will not answer your questions regarding the exam until after the exam closes, because of exam security and other students are taking the exam. So once the exam closes, we can set up an appointment if you want to do that, but we will not talk about any specific exam questions. We'll only talk about content and discuss the content, but we will not go over the exams. And this is one of the reasons, is because of security reasons for our exams and FNU policy. So that 5-minute review usually is sufficient enough for you to look at everything. There's going to be an opportunity to achieve 5 bonus points in the course. There's a soap note challenge that we do, and we schedule them 3 times a week, different times, mornings, afternoons, nights, to give everybody a chance to participate. This is not something that we can record, so you will participate on Google Hangout. 10 students at a time can be on Hangout. And you will sign up through Sign Up Genius, which you'll get information on how to do that. But we're not able to record these. So if you want to achieve the 2 points, you need to attend 1 soap note challenge. You can attend 20 soap note challenges if you want, but you still only get 2 points. I've had many students attend 5, 6, 7, just for the knowledge that they get with doing the soap note challenges. And basically what we do is the faculty play the patient, and we give you a chief complaint, and then we help work you through the HPI, the subjective, the objective, the plan, the assessment, the diagnosis. The assessment is the diagnosis. and your plan of care. And the students really enjoy doing this. It really helps them pull things together and be able to take that chief complaint and come out with a diagnosis. So they're very, very, well received by the students, and I highly recommend you participate in them. There's also a case study that is going to be due in the middle of February, the end of February, really. And this will be an in-depth case study, and you'll have a 10-point quiz with it. And this case study is worth, or not a 10-point quiz, I'm sorry, a 3-point quiz. This case study will be a case study that we've developed on our own, and then there'll be specific questions related to what diagnosis would you have for the patient, maybe what medication would you give, what would you do if there was a family history, what would you do about the risk factors. So there's many things that may be put into that little quiz, but that quiz will be counted for 3 points if you achieve all 3 points. You may only get 1 point. You may get 2.5 points. It just depends. So your achieved points will be added to your final course score at the end of the semester. So once your exams are added up and you've achieved 80% or more, and then we add in all of your assignments, then your final bonus points will be added to that. There will not be any bonus points added to help you pass your exams. That's not something at FNU that we like to do. It's not really a good thing for us to do because we're not giving you a fair advantage to take boards, because you can't have bonus points added to your board scores. So there will not be any bonus points added to your exams, only to your final score. There's also something called the Learning Style Inventory, and I think it's a really great opportunity for you to look at this questionnaire and take it. I took this questionnaire myself, and it was very interesting on my study style, how it really told me exactly what my study style was, and it was right on the money. So I highly recommend you go in and take this questionnaire just to see what your study style is before you take any of your exams in the course. So some important information. These are the do's and don'ts. So do plan to have your assignments done at least one week ahead of time. When I was in school, I made a habit of, if my assignment was due on the 10th, I put it on my calendar that it was due on the 3rd. I bumped it up a week. So I had that 1 week leeway to play around with my assignment, make sure it looked good, clean it up, and then submit it. If you wait till the last minute and the last day of your assignment is due, you're going to have difficulty. So plan ahead, mark your calendar a week ahead, give yourself a week leeway before you turn it in. If you are having problems where you do need to have an extension for an emergency on an exam or on an assignment, you must give the faculty 48 hours notice, and it may or may not be approved. So if you are supposed to take an exam Sunday night, and it is due Sunday night at 11:59, if you email me at 11:54 and ask for an extension, you will not get that extension. If your assignment is due that day, you will not get an extension. So 48 hours in advance, you must give us information as to what's going on. I will let you know that the faculty do not work weekends. So Friday after 5 o'clock, if you email us, we most likely will not get your email until Monday. So if your assignment or your quiz or your exam is due on Sunday night and you email me Friday night, you will not get an extension on your exam because we will not be looking at our email over the weekend. Find a study partner or group. This has worked really, really well in the past for the students who's taken the course previously, to find a study partner and to work with them. We do know that there's private Facebook pages that each class has. Make sure that you when you find that study partner, that you're not putting anything on Facebook that you shouldn't be. And let faculty know if you're having difficulty. We know things happen. We know family issues happen. We know divorces happen. Children get sick, parents get old, and you have to take care of them. There's so many different things that can happen and that students have had to deal with throughout their courses at FNU. The faculty are really, really here to help you and willing to help you, and we want you to be successful. But you need to let us know if you're having trouble, and we are always an email or a phone call away. So please don't take the burden on yourself. Don't get yourself in trouble in the course. Let us know what's going on. So some of the don'ts. One of the things I can't stress to you enough in this course is do not memorize the information. You have to understand this information. You are only a step away from your patient being alive and from you hurting your patient if you don't understand the information. So you cannot memorize it. You cannot memorize it for an exam and think that you're going to know it in practice. It's not going to work for you. It's not going to work for you in any of these primary care courses. So I can't stress that enough. If you are the type of person who memorizes to get through your course, you will not be able to pass these 3 courses in primary care. You need to understand that. You need to go back to your patho. You need to go back to your farm. You need to go back to your physical assessment. And all of those 3 Ps are incorporated in these primary care courses. So you have to pull from all of those courses now. This is a completely different way of thinking. It is a completely new concept for you because you have to leave the nursing model and now you have to go to the medical model. And that seems to be very difficult in the first 3 or 4 weeks of the course for students to grasp. You cannot think like a nurse anymore. You have to think like a physician, and your whole thought process changes. We'll talk a little bit more about that when we do the BBB session. So do not wait to begin a module or to study for a test, as I said. If you try, you can't go ahead in the modules and work ahead. You'll be all messed up in the course. So don't take your module, if you're done with module 1, don't start module 2 or 3. Try to stay with the rest of your class because you're going to struggle if you don't do that. Do not start your assignments on a Friday that are due on Monday. We just talked about that because of the faculty being off on the weekends. And sometimes we work weekends on our practice days, or we may be picking up extra shifts. Dr. Wilkinson works in an emergency room, so she never knows when she's going to be working. And do not take a test when IT is closed because you may not be able to reach them. They do not work holidays. And so make sure you're taking your test when IT is open. There's a link in the course in the modules for students' recommendations for course success that other students have put in there. I have also added this. If you don't understand a concept, search for another resource to help you understand that concept. You can go out of the course to find things. Go out of the course and Google things and look things up and research things and read articles if you need to do that. You have to search for other resources to help you understand the concept. So do that if you can't grasp it from the course. That's a responsibility you have as a graduate student, is to look things up. I do a blueprint for the midterm. They're helpful, but they're not all inclusive. So they will help to steer your studying for the midterm, but don't rely on them for everything. The blueprint is only for the midterm, as I said, not for the exams. The exams are small exams. They're more like quiz exams. So, but the blueprint for the midterm will be something to help guide you. Your success in this class depends on you being able to use your resources successfully, to critically think, and as I said, to incorporate your 3 Ps. So this is not an easy course. It's a course where all the primary care courses are courses where the students really have to think differently. You use your critical thinking skills, put on that thinking cap, and you will be successful in the courses. You just have to really work through them. The first 3 weeks are difficult until you learn what we're doing, how you're doing it, how you treat patients. This is all new to you. So, you're going to struggle for a little while. And then it's interesting because when the students get into like week 4, they have that aha moment. Things start to click with them and the light bulb goes on and you go, okay, now I'm getting this. So just know that all the students go through this in the first 3 weeks of the course, and then you start to get it, okay? So it's up to you to be successful. You know what you have to do to be successful. You know your own study habits. Take the questionnaire and see if your study habits are accurate for you. And we really look forward to working with you in this course and to having a great semester with you.